Your feces may hold the secret to eternal life. Doctors often stress the importance of examining one's feces after defecation, as it can provide insight into one's health. But, who would have thought that the key to reversing the effects of aging could also be found within feces, specifically in the gut microbiome? The gut microbiome, often referred to as the second brain, is a complex system that plays a crucial role in overall health and well-being. Researchers began to ponder, could changing the feces or gut microbiome lead to rejuvenation in the elderly? To test this idea, a study was conducted using mice and published in the Microbiome Journal. The scientists collected feces from mice of different ages, ranging from 3-month-old, equivalent to about 20 years old in humans, to 24-month-old, equivalent to about 70 years old in humans. They then created a feces slurry from each age group and gave a 3-day course of antibiotics to the mice to clear out their gut microbiome before transplanting the feces from other age groups. This resulted in the old mice receiving the gut microbiome of young mice, while the young mice received the gut microbiome of old mice. The study conducted on mice revealed that transplantation of feces from young mice led to remarkable physical changes in the older mice. The research team carried out blood and tissue analysis to understand the impact of the transplant. They found that the characteristics of aging in the gut, eyes, and brain of the older mice were reversed as a result of the transplant. Scientists have discovered that transplanting the feces of young mice into the bodies of older mice can lead to significant changes in the brain and visual system. The density of microglial cells, which play a role in neurodegeneration, decreased in the brains of older mice. Additionally, inflammation levels also dropped after the transplant. In terms of vision, the levels of proteins that can cause retinal degeneration were found to be similar to those of young mice, and another protein that is important for visual pigment regeneration returned to normal levels. Moreover, the integrity of the epithelial barrier in the gut of older mice was also improved. This is important because a compromised gut barrier, also known as a leaky gut, can allow harmful bacteria, toxins, and other substances to enter the bloodstream and lead to systemic inflammation. The study revealed that transplanting feces from young mice led to significant improvements in the leaky gut condition of older mice. Analysis of blood proteins showed a decrease in 2 markers of leaky gut by 30% and returning to the levels of youth. Additionally, the metabolism of lipids and vitamins in the gut of older mice improved. However, the opposite effect was observed in young mice that received feces from older mice, which experienced rapid aging, including gut leakage, increased inflammation in the brain and eyes, and an increase in the protein that causes retinal degeneration. Overall, the research suggests that there is a strong correlation between the gut microbiome and aging within the body, and similar mechanisms may be present in humans. The study revealed that transplanting feces from young mice led to significant improvements in the leaky gut condition of older mice. Treat your intestinal with care. Hippocrates, an ancient Greek physician, famously said, "All disease begins in the gut and let food be thy medicine," more than 2,000 years ago. It's difficult to dispute how foresighted these statements were. A significant area of research is preserving the balance of the gut microbiome. Here are some pointers for your review. 1. Maintain a balanced diet and consume more dietary fiber. Different dietary habits shape different gut microbiomes. Following dietary guidelines for balance is enough to keep our microbial garden beautiful. In addition, many beneficial bacteria use dietary fiber as food. It's good to supplement with high-fiber foods such as beans, celery, mushrooms, kelp, etc. to fertilize our intestinal garden. 2. Avoid using antibiotics excessively. Many people take a few amoxicillin or cephalosporin when they have a cold, fever, or sore throat, mistaking them for anti-inflammatory medications. The gut microbiome can be harmed by antibiotics, and this can impair the gut barrier, which can have detrimental consequences on the immune system, metabolism, obesity, anxiety, and behavior. Antibiotics should only be administered under a doctor's supervision and avoided when there is no bacterial infection if you don't want to carelessly wipe out your gut's indigenous inhabitants. 3. Adding probiotic supplements when necessary. Probiotics are bacteria that, when taken in appropriate quantities, can improve host health. There is evidence that probiotics can enhance gut microbiomes and may be useful in treating various neurological illnesses. However, there is little general evidence that probiotics can improve disease, and only some strains of probiotics are useful in particular circumstances. It is advised not to haphazardly purchase and consume them as a nutritional supplement if there are no particular conditions. Taking care of your gut bacteria may help you stay young and get in shape. Learn more about how important it is to take care of your gut health at wellnesswang.com.